Margaret. Memorial Day weekend is upon us. It's the time for grilling juicy, delicious hot dogs. And hot dogs are ultra-processed food. Should you feel guilty about enjoying them? No, according to our guest.
We don't need more rhetoric demonizing so-called bad food. Those are not the solutions, nor are they the tools that people actually need to make better choices.
Gabriel Rosenberg and Jan Dutkiewicz are authors of the book Feed the People: Why Industrial Food is Good and How to Make It Even Better.
But it's absolutely bonkers to say that a can of Coke is just as nutritionally unsound as an Impossible Burger, is just as nutritionally unsound as baby formula, which is what Nova does, which is why in the book we basically argue that Nova is absolutely not fit for purpose.
This is Conversations on Healthcare.
Well, Gabe and Jan, welcome to Conversations on Healthcare.
Hey, it's great to be here.
Great.
Yeah, thanks for having us.
Absolutely. Gabe, let's start with you. How do you find, maybe our audience would be interested in this, I know they will be, define industrial foods, and what does it entail?
Yeah, so when we talk about industrial foods, what we mean are foods that are produced through reliable standard inputs and that create reliable standard outputs. We want to emphasize that these are foods that are conceived to be kind of like universal goods, that you should be able to get the same high quality standardized food wherever you are, at any supermarket, at any restaurant. And that's what we mean by industrial. Industrial for us is a claim about the ability of large scale systems to provide these kinds of public goods, and certainly for a very, very diverse and large population of individuals, such as those that live in the United States.
Well, Jan, you write a lot about Waffle House. Just hearing the name Waffle House, I think for most of our audience, you conjure up immediately the visual. It's very distinct, kind of iconoclastic in the U.S. But why does Waffle House come up for particular mention and praise? I think you even refer to it as unparalleled in human history. So that really caught my attention.
Well, we think the Waffle House, and of course not just the Waffle House, but we think the Waffle House is exemplary of many of the things that are good about the industrial food system. The Waffle House churns out millions of waffles a year that are standard in quality, that are delicious, that are relatively affordable. The Waffle House itself is a democratic, no frills place where everyone is welcome 24 hours a day, 7 days a week. And so we think that a vision for a good food system should look a lot like a Waffle House, perhaps a Waffle House with some slightly more nutritious options, perhaps a Waffle House with slightly better treatment of labor. But we think that ultimately a better food system should be about improving the average diet for the average person in a non-moralistic, not hoity-toity way. And we think that in that sense, and of course, Anthony Bourdain agreed, the Waffle House truly is exemplary.
Well, the only problem with the Waffle House, they're only in 25 states.
Really?
So we're only Connecticut and California. For those of us on the coast, various coasts, they're not there. But for those in those states that have it, I know you really enjoy it. Gabe, the other part of your book explains how to make industrial food even better. I think that's really the thesis of the book. What do you recommend?
Well, we have a whole list of kind of policies, but I prefer to just kind of boil it down to the sort of basics, which is that when we look at the industrial food system, one of the questions we want to ask is like, what does it already do? What's already good about it? What is it about it that we want to preserve? And that's the question that we've already kind of addressed here, even in the early goings, which is the incredible abundance of affordable food and more choices than most people have ever experienced throughout the rest of human history. So there's an incredible abundance of food. What are the problems with industrial food? Well, some of those problems might include that a lot of the food system produces food in unsustainable ways that have dramatic environmental costs. Second, that our diet on the whole is not terribly nutritious, and it could certainly be more nutritious. And third, that a lot of the people who work in the food system are mistreated or underpaid. So when we talk about how we want to make industrial food better, we want to talk about the kinds of large-scale changes or transformations in the political economy of food, and specifically through better regulation of the food system, that is, using the power of the state to improve the actual output of that system, to reduce environmental externalities, to improve nutrition, to improve accessibility, and to improve fairness within the food system. When we do that, what we're making an argument for here, to circle back to what Jan said, is that we're saying that a better food system doesn't look like something that's radically different than what we have now. What it actually looks like is improving the average diet and the average meal that's served. And that's a really important point that we want to kind of emphasize here. Our approach asks, how can we make that average meal a lot better? How can we make it less environmentally costly? How can we make it fairer? How can we make it more nutritious? And that's the concept that we play with in the book. And then we have a whole host of policy and political solutions to those problems.
Well, I had a different question in mind, but you've really intrigued me with your answer to Mark's question. And if you asked me prior to meeting with the two of you and doing some reading on the background, I would say the number one thing that everyone is hearing right now this year, maybe the last year and a half, is that obesity, which I think you would agree is a national health crisis, is significantly tied to a preponderance of what you're calling industrial food or highly processed food. I don't know if we can use those interchangeably, not in the American diet. So tease that one out for me, one of you, and let's help clarify that one for our audience.
Yeah, I'll let Jan handle that in 1 second. I do want to emphasize here that we do not, first and foremost, we do not treat industrial and highly processed as necessarily one and the same. The second thing that we would emphasize is that, like, when we talk about these problems and we talk specifically about a health crisis around American diets, we want to start by reckoning with what we don't think is a very effective strategy to solving that problem. Mm-hmm. And that is that I doubt that the reason why most people eat unhealthy food, so-called junk food, food that nutritionists and doctors would look askance at and would say, "Hey, don't eat that. That's not good for you. It's empty calories with no nutritional value." Overwhelmingly, the situation is not that people don't know it's unhealthy. We don't need more rhetoric demonizing so-called bad food. Those are not the solutions, nor are they the tools that people actually need to make better choices. There is no paucity in the United States today of people haranguing you for eating junk food. And we all know what junk food is. This is not the issue, right? So one of the questions that we want to ask are, what are specifically the foods that are causing metabolic illness? What are the foods that are unhealthy for us? And that's where we want to disaggregate, for example, processing on the one hand from foods that do contribute to negative nutritional and health outcomes. And so, Jan, I guess I would hand it off to you on this question of how we want to disaggregate those things.
Yeah, I mean, the first thing I would say is that industrial food is virtually all food we eat, right? Like if you go to the produce aisle at the Key Foods down the street in Brooklyn, the apples, the asparagus, the bananas, the coffee, just as much as the Fruit Loops and the Doritos are all industrial products. They come from crops that are produced at scale to set standards within set regulatory guidelines. So when we say industrial food, we mean virtually all food we eat, food produced on industrial principles and not any particular way of producing food. So that's point number one. Point number two is that the categorization of foods into unprocessed, processed, ultra-processed is extremely recent. It comes from a Brazilian epidemiological schema called NOVA, often capitalized as if it were an acronym to give it scientific gravitas. It is not an acronym. It's just the Portuguese word for new. Mm-hmm. And the idea was to create an epidemiological schema for mapping overall content of diet onto health outcomes in particular populations. And so the schema that was created was Nova 1 unprocessed, Nova 2 household dietary ingredients, Nova 3 processed, so foods that combine the previous two categories. And then this gigantic category called Nova 4 ultra processed, which is basically all and any food that contains ingredients not found in the usual kitchen or processes that are not available to the usual cook, which is a gigantic category that includes everything from Fruit Loops to whey protein isolate to Beyond Burgers to flash frozen palak paneer at the Trader Joe's to baby formula. It's an absolutely unwieldy and unuseful way of thinking about food thinking about food's nutritional qualities, because it was never designed to adjudicate food's nutritional quality in the first place. At least not at the level of individual foods.
Yeah.
It was meant to understand the makeup of diets, right? And so what's happened is, so Nova would, for instance, say, well, if we have high incidence of obesity in particular communities and not other communities, and the former community eats a diet of, let's say, 75% Nova ultra processed, and the latter community eats a diet of, let's say, 50% Nova ultra processed, and there are differences in health, we might be able to point to the ultra processed foods as the culprit. This is how Nova was intended to be used. The way it's come to be used is to suggest that foods that are quote unquote ultra processed are somehow inherently unhealthful. And we quite simply know that's not the case. Because if you look at studies that try to find correlation or causation between the consumption of ultra-processed foods and negative health outcomes, and you actually dig into the data, what you'll find is that quote-unquote ultra-processed foods are only really sort of in a statistically meaningful sense correlated to negative health outcomes when they contain the things we already know are bad. So sodium, sugar, fat, red meat. In fact, we have studies showing that a high consumption of ultra-processed vegetables is actually healthy, is correlated with reduced morbidity. Why? Because you're actually eating more vegetables, right? What we do know, however, is that many products formulated to be ultra-processed are made hyper-palatable, which is to say that they're made to be sort of addictively crunchy or easy to digest. And so when quote unquote ultra processed foods are vehicles for a lot of salt, a lot of sugar, a lot of calories in a way that's sort of addictively snackable, then yes, they can lead to an increase in morbidity. But it's absolutely bonkers to say that a can of Coke is just as nutritionally unsound as an Impossible Burger, is just as nutritionally unsound as baby formula, which is what Nova does, which is why in the book we basically argue that Nova is absolutely not fit for purpose. And it's not just us, right? Like there was a paper in 2022 where a number of health practitioners and PhDs were asked to sort foods into the Nova categories, and they weren't able to do so. I can send you the paper, right? So something that a bunch of PhDs and practitioners can't use, and that actually doesn't statistically mean anything at the population level.
But you fully answered my question, and I really appreciate that. You answered about 10 questions that I had, so I want to give back to Mark for his next question.
Well, I want to pick up on two words used, shame and obesity. And certainly shame has never done anything to help improve people's diet. And obesity is a major problem. And so it brings me to GLP-1 drugs and what your sort of general thought on that, because it's having a profound impact. We see that it's reducing the amount of food being purchased at grocery stores, I think by 6 to 8%. And it's sort of interestingly moving people to healthier food if there's something called healthier food. But what are your observations about the impact that GLP is having writ large?
Relatively early in the goings, but it seems to me that it's a real game changer, and it's going to have an absolutely massive impact on how certainly clinicians and public health authorities begin to think about what are the most effective ways of dealing with negative health outcomes associated with diet. So we talk about it actually in the book pretty briefly, but I think to salient effect, which is to say that when we talk about GLP-1s, one of the things that we want to emphasize is that the core reason why GLP-1s work or seem to work as far as the science suggests, is that they kind of like dampen those portions of the brain that like
food noise,
the body that it continues to be hungry. Yeah, so-called food noise, right? So instead of like eating things that bypass the satiety instinct, like things that are hyper palatable, instead we get a person who experiences, in some senses, less desire to eat food, and as a result, tends to be more disciplined in how they make their choices, right? And so this is one of those situations where the family doctor that you would have gone to 5, 10, 15, 20 years ago, and if you ask them as the general kind of common sense, conventional wisdom about how you should deal with problems like being overweight, that doctor would probably say something like, you should be more active and you should eat fewer calories, right? Or you need to be more disciplined in both your exercise and your diet.
right?
As a prescription, that's not terribly helpful, right? Telling people to be more disciplined is not terribly helpful. But it actually tells us something, which is that insight was probably correct. The problem is that people can't follow that prescription. GLP-1s show us that's true, right? What GLP-1s do is essentially give us, in some senses, the discipline or the willpower to follow what was already the conventional wisdom about how to lose weight and be healthier in our diets.
But isn't it
so they reinforce
food,
our choice making.
right? But just thinking, the food industrial community there is also addicting people by food taste, by all the money that they spend on really addicting people to food. So part of this is industrial food may be good, but at the same time, there are lots of unsavory characters in there who are trying to make us eat more Cheetos, so how do you balance that?
Yeah. So the first thing I think we would say is that we want to arm consumers with the ability to make the choice that's best for them as individuals, and that balances their freedom of choice with their desires and their tastes as individuals. All right. So we want to put that out there first. And the second thing is that we wouldn't want to say that consumers have to bear all of the responsibility for figuring out which food items are healthy, nutritious, or frankly toxic. Like, in other words, if there are particular techniques of processing that lead to catastrophic health outcomes at a population level, we don't think it's up to individuals to have to sort those issues. That's why we have a regulatory state. And so what we're asking for here is, in some senses, for people to ease up on individuals and making individual choice and responsibility, the primary way that we think about what are largely structural problems, which is to say that maybe food producers have a lot of economic incentive to produce food that's addictive and snackably addictive or hyperpalatable. And the real solution to that is better regulation. It may be better tax policy. Those are not things that as individuals we really have the ability to choose at the supermarket. Those are things that we need to put pressure on legislators and politicians to help create better laws and to help the institutions that we have do a better job of regulating that food system. That's what the state is supposed to be there for. I know that's a little passé and may ring a little perhaps nostalgic to some of your listeners, but we remain committed to the idea that the state should be regulating the food system to make it healthier.
Yeah, I mean, it's also tricky, right? Like, what are you going to do? You're not going to ban Cheetos. Right. Like there's no
an uprising.
I mean, no, but I'm just saying, like, it's one thing to say that, yes, there are corporate interests that are interested in selling people all kinds of foods that may not be healthful. Sure. But short of policy that would ban Cheetos, that would completely
Michael Bloomberg tried to ban the large.
He tried to ban large drinks and was pilloried and was pilloried.
Right, absolutely.
He also tried to get sugary drinks out of Snap at the New York level as ostensibly as a pilot, but was shut down by the USDA. And so attempts to drastically restrict what consumers eat are very politically unpopular, right? So while we should be pursuing policies to, for instance, impose things like sin taxes or Pigovian taxes on sugary drinks, you're not going to get rid of the Cheetos at the supermarket. And so going back to your initial question, what GLP-1s do is they potentially give people the ability to make slightly more reasoned choices in environments that might otherwise be obesogenic or that might drive them to unhealthy choices.
And
it's not an ideal fix.
Right.
Right.
And
But
it's a piece of the pie, because the other piece of the pie, of course, that we're all dealing with, and maybe we'll come back to this if we have time, is the policy decisions and the social reality of inadequate incomes to purchase a diet that is broad-based and healthy, and the factor of satiety, what's available in your neighborhood store, what makes your food dollar go the furthest, is also a very real and present one that we live with, certainly.
42 million Americans on SNAP.
On SNAP, and then losing even that.
Kids,
but before we maybe try and tackle that, I'm always curious about the personal experience when people are writing their book. So, Gabe, you talk about your experience where you personally mostly ate plant-based meal replacement products. How was that for you? What was your experience?
Oh, so not mostly. This is very
entirely.
I did 100% of what's called the Huel diet. Why we invented the Huel diet, right? Yeah, no one ever recommended that you should eat 100% of this sort of meal replacement plan. We were doing it a little bit tongue in cheek. I think we've been criticized sometimes for suggesting that there was a lot of scientific validity in this experiment. There was no scientific validity in the experiment whatsoever. It's an N of 1. We're happy to say that it was a writerly conceit, tongue in cheek, sending up the general sort of foodie book autoethnography experiment that you might remember from Super Size Me. What did I learn? Number one, that you can eat a diet of ultra-processed pea protein more or less continuously for a month without it actually adversely affecting your physical health. I also learned that doing so is extremely brutally unpleasant, and so it arguably may have a negative or adverse effects on your mental health. That's a different issue. But as a general matter, what we were trying to sort of demonstrate there is that this catch-all category, as Jan just referenced, of the UPF, it's a big category, and it catches a lot of things that are perfectly healthy, perfectly nutritious, and you should feel safe and secure having in your diet. Now, I wouldn't say eat a 100% all Huel diet. That wouldn't be my personal recommendation to you, but I will tell you this. I still eat Huel products maybe once or twice a week. Some of their products I like very much when I'm on the go. I don't think that there's any shame in subbing it in if I don't have time to cook myself a full meal. They tend to be very nutritious, and frankly, they taste pretty good relative to their competitors as far as I'm concerned.
Margaret, you wanted to get a little to policy, and I'm wondering, Jan, Health and Human Service Secretary Robert F. Kennedy Jr. wants hospitals to do away with Jello, orange juice for patients. He's also threatening to cut off federal funding for hospitals if they continue serving items with too much sugar. What's your reaction?
My reaction is that the quality of institutional food is very much a product of the budgets available to produce that food and the means available to get that food to the people eating it. So just to shift it away, we did some reporting at New York City hospitals that ultimately didn't make it past the cutting room floor for the book. But New York City hospitals under Mayor Adams actually instituted a policy aimed at crafting more nutritious, less environmentally impactful, so more plant-based meals for all its hospitals at set budgets, and actually achieved those aims. And they did it not by sort of making these headline-grabbing moves like banning orange juice or whatever, right? Nothing was banned. No food category was deemed inherently sort of morally untenable or unhealthful, right? Rather, what they did is that they looked at their budgets, they reformulated meals accordingly, and came out with more healthful meals while also providing training to people at hospitals and how to talk to patients about nutrition. Mm-hmm. And so this sort of approach, so rather than sort of parachuting in and banning, thinking really about the availability of budgets and the overall quality of diets, is a much better approach, right? We've also seen this with school lunches, right? School lunches have a really bad reputation, but since the Obama administration, with the possibility of universal school lunches at the sort of city and county level through the community eligibility provision, we've seen a lot of cities, again, like New York City, take school nutrition very seriously and working with relatively constrained budgets, right? So $7 per student per day in New York City, really think about how to tweak menus to deliver fruits, vegetables, and more healthful diets to students on a small budget. Yet again, nothing was banned, nothing was pilloried, nothing was sort of critiqued any individual food, but rather the idea was to reformulate the general dietary quality. And it's those kind of interventions that really work, right? Like hospitals are not trying to poison anyone with the foods they're feeding people as it stands.
Yeah. Can I add here very quickly that it makes me think that RFK has never spoken to a doctor and asked them, why do hospitals serve Jello? Like, why do they do that? Number one, it's a food source that people who are having a difficult time swallowing can eat. And number two, it's a lot of calories for people who are having a hard time keeping food down. Right. Those are the two things. Right. And if you talk to any doctor, they'll tell you that. It's astonishing to me that they would propose withholding federal funds on the basis of serving too much Jello. No one's out here saying that we should be eating 100% Jello diets. But these foods actually do play important roles in medical treatment, right? And so this cheap and easy demonization of industrial foods more broadly, but of foods with too much sugar, this is all substitution for thought, for actually thinking. What is it that this food does? How is it being used within the context of a hospital, right? That's the real thing that we're really kind of trying to push back against here in this moment when food seems to be freighted with so much moral consternation and so much, pique and ire and anxiety. And we want to say, slow down, turn the temperature down. Why are we all out here picketing to ban Jello? This is a pretty ridiculous situation. We want to be very, very careful about making those kinds of big institutional changes on the basis of what amounts to pretty sleazy opportunism of people being wound up about food.
Well, I think a couple of expressions that I always heard as a kid come to mind: moderation in all things, right? And hunger is the best sauce were two things that were repeated regularly around my my family's dinner table, and I think both of those are still true.
Yeah.
But food access is a huge issue in neighborhoods and communities, schools, hospitals as well. And one thing that, Gabe, I think you commented on was that community gardens are sometimes thought of as, well, this is a great solution to deliver food in neighborhoods or deliver it locally. But you say, not so much. The claim is said a lot, but doesn't translate. How did you come to focus on community gardens, and where did you draw your conclusion?
Well, certainly within, I think, food activist circles, there's a lot of enthusiasm and understandable enthusiasm for community gardens. And we're very careful about this in the book, and I would be happy to say it now, that community gardens do serve a really valuable purpose in a lot of communities around the country. Those purposes are primarily, I would say, sociological and cultural. They help people experience nature. They have ineffable sort of cultural value in terms of bringing people together, allowing them to share the experience of working in a garden. Those are beautiful things. I have my own little herb garden. Jan has memories of gardening, and I make gardens still. We're not anti-gardening. Unfortunately, it's a very inefficient and costly way to create food, particularly in urban spaces, and it doesn't create very much given the amount of investment in it. And that's the long and the short of it. If the problem that we're trying to solve is that people can't get the food that they need, in other words, there is a problem here where people are going hungry. We say that's a real problem. As you said, 42 million Americans on SNAP. Obviously, those are individuals who are having a difficult time getting the resources they need to feed themselves. Primarily, though, we want to avoid confusing availability with access. All right. Availability is when there is physically not food on the shelves to buy. Access is when people lack the resources to purchase the food that they need, even when it is available. Most hunger and malnutrition in the United States is tied to access problems, not availability problems. And so distilled down to an even more basic level, what that means is that when we talk about hunger in the United States and we talk about, empty bellies and making sure that everyone gets fed, what we're really talking about here is a resource problem. If it's a resource problem, the next question you have to ask is, how do you solve a resource problem when resources are scarce? How do you address it? You don't address it by trying to feed people using the most expensive way of producing food vis-a-vis a community garden. Instead, you have much more efficient ways. Number one, SNAP is an incredibly efficient way of getting resources to hungry people. It should be more generous. There are ways of altering the qualifications that we would also be happy to talk about. There are other changes to the program that could make it, I think, more generous and more effective. And second, universal school lunches. Like, number one, just an absolute fantastic, empirically proven way to address, I would say, the most pernicious and unfortunate form of food insecurity. And that is the food insecurity that millions of American children experience. And universal school lunches are incredibly effective at improving nutritional outcomes, getting those kids fed, and reducing the stigma that's associated with eating school lunches that are subsidized.
Well, thank you, Gabe and Jan, for joining us. The book is Feed the People, Why Industrial Food is Good and How to Make It Even Better. And the publisher is Basic Books. Remember to subscribe to our videos and on YouTube, and find us on Facebook and X. You can also share your thoughts and comments about this program. Take care and be well.
This copyrighted program is produced by Conversations on Healthcare and cannot be reproduced or retransmitted in whole or in part without the express written consent from Community Health Center, Inc. The views expressed by guests are their own, and they do not necessarily reflect the opinion of Conversations on Healthcare or its affiliated entities.